Let's move into MTHFR. Top question, top concern I get on a regular basis is um, should I supplement because I have an MTHFR mutation? Or do I need to take folate for the rest of my life just because? There's a lot of fear around that. There's
Hmm.
also there's a lot of fear around somebody thinking they should do something vastly different because they have an MTHFR mutation than if they didn't have an MTHFR mutation.
Hmm.
As an example, um, I have a thyroid condition and I'm MTHFR. I don't know what to do. And that's, in other words, the question is, it's like the MTHFR supersedes whatever the condition is in their mind. They're actually affixing MTHFR as if it's a disease state,
Hmm.
and that it changes how they should behave in every aspect of their life or in any diagnosis that they've had. Can you kind of walk us through MTHFR, explain it a little bit, and explain what people should be concerned by and about, and what action steps they can take with MTHFR, and many examples that you want to give? I just want the audience to really understand that arena.
Yeah, I'm trying to think of an example. Um, just because you have something doesn't mean you have to do it. Um, and there is a lot of fear around the topic of MTHFR. And let's just let's just zoom out for a second. MTHFR is one particular gene in your body out of 18,000. And it is an extremely important gene with a very, very important function. Its job is to produce your body's number one form of folate called methylfolate. That's its job, and that's its not its really its only job. It also regulates upstream forms of folate too that people don't talk about. It helps conserve upstream folate for red blood cell, platelets, white blood cells, skin repair, hair growth, and all that. Um, so there are benefits to having a slower MTHFR enzyme that people just don't realize, and it's not talked about. I do talk about it in the book. Um, and we also, let's zoom out even further about, okay, if MTHFR is so prevalent and we go by the concept of survival of the fittest, then there must be some evolutionary benefit to having this MTHFR variation. Well, there actually is, because people who had malaria and who had the MTHFR genetic variation survived better than those who did not have the MTHFR variation. And again, why is that? Because if you have an MTHFR genetic variation, you're conserving upstream folate to support blood cell synthesis. And if you have malaria, your red blood cells, from my understanding, die and they break and they burst. And so if you have MTHFR, you're conserving the upstream folate to help produce more healthy red blood cells, platelets, white blood cells, and so on. And so you live through malaria. Um, so that is pretty cool. Um, what I'll also say that we are indeed seeing an increase of the MTHFR genetic variation in the population across, for the most part, all types of ancestries: Japanese, Chinese, Italians, Americans, Caucasians, and so on. I mean, just all the way across. And why would that be? And it would be for various reasons. We are increasing in vitro fertilization. We are increasing folic acid in the foods. We are increasing nutrient density through food and giving pregnant women and men, not pregnant men, pregnant women, but men prior to conception, giving them healthier forms of folate. And this supports the pregnancy of a woman whose baby has the MTHFR genetic variation, who would have probably otherwise aborted and died in utero. If you looked, there was a research paper that I recently looked at. Japanese people, there was a very, very low incidence of MTHFR in the elderly. There's an increased incidence of MTHFR in the middle-aged population, and there's a significant increase in the younger population. So MTHFR is indeed increasing in the population because of folic acid, IVF, and nutrient density, and so on. And I'm not saying that we should stop IVF treatments. I'm not saying that we should stop supporting individuals with MTHFR variations who get pregnant. I'm just saying that we are increasing the frequency of MTHFR variations in the population because of these things. And it's super important to be mindful of, especially as a future parent, because if you are struggling to have a baby, and I'll get into this MTHFR thing here in a second, but I want to hit this point. If you're struggling to get pregnant, you're infertile, or your husband's infertile, or what have you, or your partner, and you work on your fertility, you become fertile, you have a baby, but in order to have that baby, you are on steroids, you're taking amounts of methylfolate and folinic acid. Sometimes your doctor prescribes you 4 to 5 milligrams of folic acid, which does help, babies come to fruition. However, it is the worst form of folate you can use, and there are consequences of that. And then when you do succeed in having a baby, you all celebrate. It's like, wow, I had multiple miscarriages. I was infertile for so long. And then you're holding this beautiful baby in your hands and you celebrate. And then you kind of stop thinking about it because now you have a healthy baby. Well, you have a healthy baby that came into the world only because you did so many things and intervened in so many ways to have that baby born into this toxic world. And so you've only started supporting that baby for 9 months. Now they have a lifetime to make sure that most likely genetically inferior baby needs support. And it's partly why we're seeing autism skyrocket, is because we're seeing genetically inferior babies being born into the world, and they need more and more support. And again, that is not something that is bad. It's something that we need to be very mindful of as parents and health professionals to, make sure that the nourishing the mother and the father and the baby in utero does not stop once it's born. So going back to the original question of if somebody is diagnosed with MTHFR, it sounds like a disease state. Let me actually look this up because it bugs me. I always mess it up. American College of Medical Genetics and Genomics, ACMG. They don't like me very much. And they don't like me because they say that, and I'm paraphrasing, they say that I promote misinformation around MTHFR, and their guidelines are, if you have been diagnosed meaning it's a disease state, with an MTHFR variant, that their statement says, doesn't matter, it's super common, there's no real consequences, just take folic acid and go through your life as normal. My statement is, you are correct in that MTHFR, if you have a genetic variation of it, it is not a disease state at all. If you have MTHFR genetic variation, it does not equal that you have a disease state. Peter, how many genetic variations are associated with celiac that if you have them, you are indeed a celiac patient?
Just a handful, not very many.
Yeah. Right. But if you have any of those genetic variations, are you indeed diagnosed with celiac?
Yeah, not at all. Not at all. You have to have the genes, or not even in all cases, but the genes are predisposition factors. So they're not guaranteed outcomes of the development of the illness. There are predispositions that if a person has them and they are exposed to gluten and the right circumstances exist, that will lead to villous atrophy of the small intestine, causing what we would consider to be celiac.
Right. But they're born, as long as they avoid all forms of gluten 110% of the time, despite having those genetic variations of celiac, they're fine, correct?
Yes.
Right. So with MTHFR, if you have a genetic variation, it does not equal that you're going to have any problems. It just shows that you are vulnerable to various things. Just like with the celiac genetic variations, if you have them, you damn well better be gluten free. And if you're not, there's going to be consequences. If you have the MTHFR genetic variation, then you should be mindful about laughing gas, nitrous oxide. You shouldn't touch that stuff. You should be mindful about methotrexate. You should talk to your doctor about methotrexate, because if you have MTHFR and you're taking methotrexate, it could really, really cause some problems. And a lot of doctors will prescribe folic acid if you are taking methotrexate, but it's really pretty stupid because methotrexate blocks an enzyme called dihydrofolate reductase. And that enzyme also is required to process folic acid. So you're taking a inhibitor of a particular enzyme and you're giving a nutrient that has to go through that same inhibited enzyme in order to do something. Very stupid. You can bypass that problem by using folinic acid. So in MTHFR, just because you have a genetic variation, for the common ones, for the most common genetic variations surrounding MTHFR, they are reducing its functional capacity, meaning its ability to perform and do work for you, anywhere from 20 to 70, 80%, which means that you have a functional MTHFR enzyme from a range of 80% functional to about 20, 30% function, which means that it's still functioning. It may not be functioning as well as if you did not have an MTHFR variant, but it's still functioning. If you're in your vehicle and you have a 20% full gas tank, you can still drive and get somewhere. And you're going to have to stop more frequently or within 20% and fill up again. If you know you have an MTHFR genetic variation and you have a capacity of your MTHFR enzyme is around 20, 30% like mine, then I'm mindful that I have a set amount of capacity for my enzyme to perform. So I need to do things that don't overwhelm it or dirty it, meaning I don't consume very much alcohol, hardly at all. I basically don't drink. I'm mindful about laughing gas. I'm mindful about my kids going to the dentist. We have it on their chart in the contraindications and medical allergies, no nitrous oxide. And I share that with a dentist. Years and years ago, when I walked into the dentist's office and I told him, or I filled out the charts for my kids, the paperwork, and I said, no laughing gas. He goes, well, that's interesting. He said, they're allergic to it. And I basically said yes, but then I explained what MTHFR was and how laughing gas is a big issue with those with MTHFR. There's lots of research behind it, which I shared with him. And then I said the potential consequences if someone gets laughing gas and they're in the chair, especially kids or elderly population. And his nurse, she turned to him and she's like, oh, that explains so much. So she saw all these patients, some of them really, really struggling post laughing gas. And a light bulb went on. She's like, that makes sense. So MTHFR variations increase your susceptibility to things, but it's still functioning. It is nowhere near the amount of fear that you are internally having about it. That is actually way worse than the variation itself. And the fear that you're having is dirtying the performance of the MTHFR enzyme even more. And while that statement might not be helpful, because when I got my genetic test back in 2011, and I found out that I had MTHFR genetic variation, a special combination called 6771298, which reduces my MTHFR's function by about 70, 80% or so, I flipped out. And then I realized, oh, it's just a functional consequence. And then I studied MTHFR. I was like, okay, what's it do? It makes an enzyme. What's the enzyme do? The enzyme makes methylfolate. Is methylfolate found somewhere? Yes, it's found in liver and leafy green vegetables. Oh, can't stand liver, but I eat my leafy greens. And what happens if methylfolate levels are low? Well, there's a backup pathway in your body called choline. And if your folate levels are low, then choline steps in and takes over for you. Well, where does choline come from? It comes from eggs and meat. Oh, I chow on eggs and meat. That's good. Well, how do I know if my MTHFR enzyme is working very well? Well, you can test homocysteine. What's that? Oh, it's a simple, very, very inexpensive lab marker. And what should a healthy homocysteine be? Labs say greater than or equal to, or less than or equal to 15 micromoles per liter is healthy. Well, not so fast. All-cause mortality research shows, meaning that homocysteine levels by itself, if elevated, increase your risk of dying of various different types of things. You really want your homocysteine levels to be between, 7, 8, 9 micromoles per liter. And so you can just check your homocysteine levels. Your homocysteine levels are healthy, then your MTHFR enzyme is functioning pretty well. And if you're consuming leafy green vegetables, you're consuming organic grass-fed beef liver or, chicken livers or what have you, great. If you're eating meat and you're getting choline from meat and eggs, that's great. Now, if you're chowing on meat heavily, let's say you've been reading Paul's book, The Carnivore Code, and you're watching him on Instagram, and back in the early days, all that guy ate was meat. And now he's adapted. He's changed it. And if you just ate tons of meat, you could become nutrient deficient in other things, and your homocysteine levels could be elevated. And there's something called the meat sweats. And the meat sweats are basically increasing your homocysteine. Or no, the meat sweats are caused by increases of homocysteine, which is caused by huge amounts of protein. So those of you who are bodybuilding, trying to increase your lean body mass, or following carnivore or paleo or what have you, and you're just maybe eating 2 grams of protein per pound of your body weight, you're overdoing it, and you're going to have high homocysteine, especially if you have an MTHFR genetic variation, because there's consequences of that. But the bottom line with MTHFR enzyme is it's a frayed rope. You should know where the fray is in that rope. You should tend to it, identify where in that rope it is, and be mindful not to be pulling on that certain section and to clean it up. And there are many things you can do to clean it up. I am 50 years old now. I am healthier than I was when I was 18 or 19 years old. And I can say that with utmost confidence, because when I was joining the University of Washington rowing team at 18 years old, they took my blood pressure, and my blood pressure was like 150/90. And they're like, what the hell? What's wrong with you? And I was like, I don't know. And I don't know what I did. And they retook my blood pressure, and it became like 140/80. And then I barely made the cutoff, and they didn't cut me from the team, which was great. But rowing is extremely high endurance, and endurance sports increase your homocysteine levels dramatically. And I didn't know that at all during the time. And so if I'd known what I'd known now as an athlete, I would have been supporting with methylfolate. And those of you who are athletes, and if you look at yourself in the mirror when you're done exercising, or somebody looks at you while you're exercising, and you're like, oh yeah, that's my beet red face. I just get a bright red face when I exercise, and breathing is a little bit more labored. That could be an MTHFR thing. Because as you exercise, your homocysteine levels increase and your MTHFR enzyme is overwhelmed. So prior to exercise, if you supplement with methylfolate or methylcobalamin, then that red face will go away. And I shared that comment years ago on a Facebook post. And this lady says, oh yeah, that's me. I'm going to try that. So she took methylfolate and methyl B12 prior to exercising nowadays. She goes, she doesn't get a red face anymore.